Hello, this is Dr. Mark Contos with daily coverage at ACOS Deer Valley, and with me today is Dr. Dee Stephenson, and she's in practice in Venice, Florida, and we're going to talk a little bit about a new phaco handpiece for phaco femto cataract surgery. Dee, thanks for taking the time to visit with me a little bit today. Let's talk a little bit about what you've got going here.
Well, you know, as technology changes, you know, it's always a continuum. You know, we've strived to have a great technique with our surgery and our surgically induced astigmatism, and then of course the femto giving us the precision and the safety, you know, aspect of it, and Aura with Verify giving us the diagnostics for the IOL power selection and toric and LRIs. But we have to relook at the instrumentation because the surgical procedure itself with femto is much different. Right. So what's been great for me is there's a new handpiece. It's not ready for prime time for everyone, but I've been lucky to use it for the last about 30 cases. It's a 15 or 30 degree, looks like a phaco tip, but it's real. All it does is aspirate. It irrigates and aspirates. So you plug it into your, INA port, and you actually, depending on the pattern that you use for your fragmentation in femto, I use a dice pattern with a cross, and I do a kind of a divide and conquer. But this actually sucks those little cubes up just by aspiration. So now we have zero power that goes through the eyes. So not only are we going to have quieter eyes, we're going to have healthier endothelium. So it's exciting for me. I think it right now goes through a 2.4 incision, and I'm a mixed surgeon, so I would like it to be smaller, 1.8, but they're working on some variations. But it's very exciting, and I really think it's, we're always looking for the end all to make everything perfect, and I think this is a good place to start to decrease the energy inside the eye.
So now you've had a chance to use this for about 30 cases. What have you seen with that? Have you noticed a difference?
Well, I was always amazed, or I have been amazed since femto has been introduced for me, how quiet the eyes are the next day. We've really kind of learned with the patient interface to cause less subconjunctival hemorrhage, and the eyes really quiet the next day. Now it's even more quiet. I would be very hard pressed for somebody to tell me that I had surgery. So it just eliminates, the turbulence that goes through the anterior chamber, and it protects the endothelium. So it's, very safe.
Yeah. Well, I know exactly kind of what you're talking about, because a lot of the time now I'm not really using the phaco part of my handpiece when I'm doing these femto cases, depending upon exactly what the cataract structure is like, but a lot of the time you're able to pretty much just aspirate those pieces out, and so it's nice to kind of have something that's really designed specifically for that. It sounds like it has a definite use with what we're doing.
Absolutely, and the port's bigger like your phaco handpiece, so it allows more to go down, because it's hard to use just an aspiration INA to pull out the the cataract itself.
Yeah, the port for the IA is really not suited for that.
Correct.
But the fluidics of the IA are just about what you want.
Exactly.
And so this gives you a way to kind of marry those two together in a more useful way. Yeah. Well, it's interesting, because with laser, we're seeing all these kind of changes in the way we do things. Instrumentation is changing a little bit, all those kinds of things, and we're kind of starting to see that wave, that second wave of technology come through from the femtocataract side of things after the laser itself, arrived. And, and this is another example of that.
Well, and we're all out for the holy grail. If we can get there with zero power, perfect, crisp clear corneas, and 20/20 vision, and all the astigmatism corrected. I mean, that's I think our goal at the end of the day, to give great outcomes.
Yeah. Well, it's exciting. I think it's kind of an interesting new innovation for cataract surgery, and I appreciate you taking the time to visit with us on it.
I thank you very much for having me.
You bet.